Assalamualaikum and salam sejahtera. Today I, Azwan bin Yusuf, will try to explain about basic cardiopulmonary resuscitation or CPR, bandaging and splinting. Okay, we go to the first slide which is CPR. Today I will try explain more about CPR and try to conduct CPR for adult, children or infant. Okay, we go to the first slide which is introduction to CPR. As we know, CPR is an emergency life-saving procedure performed when heart stop breathing immediately. CPR can be second or triple chances of survival after cardiac arrest. Why is technique CPR is important? CPR is important because it keeps the blood flow to become active and it was to avoid brain death or not function. 5 steps of high quality CPR. First, perform CPR immediately. In the first step, we can start compression within 10 seconds and then we go to push hard or push fast. To push hard or push fast, compression at a rate of 100 to 120 per minute with a depth of at least 2 inches for adults. The step is chest recoil and the fourth step is we can minimize interruption in between compression and ventilation. Try to limit interruption to less than 10 seconds. And last step is effective breath. The step CPR for non-health care provider. First step is we must check for danger safety first. When we try to save the victim, we can look around at the victim to ensure the compound is safe. Second is we must check response of victim. We can check response like ask her question or we can tap her or his shoulder. Third step is we can activate the emergency response system like we can call 999. And last step is automate external defibrillator. I will provide the video tutorial. First step is place infant in the flat space. Second step is place two fingers in the center of infant chest and give compression at a rate of 100 to 120 per minute. Compress at least on the epidiameter of the infection about a 4 cm. At the end of each compression, make sure lower the chest to fully recoil. After every 15 compression, open the airway and we will hit to the chin lip and give to wrap each other 1 second. Okay, we go to second is bandaging. A bandage should never be applied directly over a wound. It should be used only to hold in place the dressing which cover a wound. A bandage should be applied firmly and fastened securely. It should not be applied so tightly that it stops circulation or so loosely that it allows the dressing to slip. If bandages work themselves loose or become unfastened, wound may bleed and they may become infected. For the bandaging, I will use covered of knee techniques. This technique is used to hold dressing around the knee. Then a step for use this technique is first step is center of cupboard over kneecap and let's hand hang down each side of knee. Second, cross and underneath and continue several overlapping, descending, turn down cup and several overlapping ascending, turn up tight. And third step is brings and together and tie under knee. I will provide the video tutorial. First step is place center of cupboard over kneecap and legs and hang down each side of knee. Second step is cross and underneath and continue several overlapping descending, turn down cup and several overlapping ascending, turn up tight. Third is bring and together and tie under knee. Okay, we go to the third, which is splinting. Splint are used for support and immobilize suspected fracture, discoloration or severe sprain. Second is to help control bleeding. Third, to help control pain. Fourth is to prevent further damage to tissues from the movement of bone end. Okay, this is rule when we want to use splinting. First, do not splint if it will cause more pain for the victim. Second is assess the full pulse and sensation below the injury area before and after splinting. Third is immobilize the joint both above and below the injury part. 4 is cover all wound, including open fracture. 5 is never intentionally replace protruding bone end. And 6 is apply the splint before trying to move the victim. I will provide the video tutorial.